With headlines like this one, it's time for a refresher about how the Texas Medical Center shares data about ICU bed capacity and occupancy. I'm Brady Smith to break it down. During a spike in hospitalizations last June, the Med Center rolled out this chart. At the time, CEO Bill McKeon said the goal was to illustrate that ICU space is flexible, but that it also has limits. There is a lot of information here, and just so we're clear, these numbers are from August 10th. Here's what we're looking at. These numbers are the total capacity for each phase. So phase 1 is the level at which the Med Center always operated pre-pandemic. To address the overwhelming need for intensive care, phases 2 and 3 were created. Altogether, that's 2,207 beds. These yellow lines indicate how many total beds are occupied right now, 1,430, and how many of those are COVID-19 positive, 464. If we slide to the other side of the chart, we get a weekly average of how this stacks up. So I want to offer some context here too. The Med Center admitted 354 new COVID-19 positive patients on August 10th. Compare that to last week's average of 320 a day and last month, 58 a day. The numbers are only growing. Right now, the weekly average shows 100% of phase 1 ICU beds in the Med Center are full. 35% of those are COVID-19 patients. Overall, combining all 3 phases, 65% of ICU beds are occupied, 21% of which are COVID-19 patients. The chart does stress that there's room to expand. Medical surgical beds can be converted to ICU beds by delaying some procedures, and that's why Governor Abbott asked doctors earlier this week to hold off on elective surgeries. So why are you seeing headlines about only 27 ICU beds available in the greater Houston area? Well, that's what the Texas Department of State Health Services reports, that there are just 27 staffed ICU beds in what's called Trauma Service Area Q, which covers Harris and 8 other counties with a population of nearly 7 million. So the Med Center says it has the capacity, but it's still unclear whether staff is available for those beds. Governor Abbott mentioned earlier this week that the state health department is working to bring in out-of-state medical professionals to help with the surge.